Another excellent job. We're close to finishing, but not just yet. We have something else special as well, and I wanted to, before the end at least, reiterate things that were mentioned by Dr. Spack, Professor Valdimon, and our honored professor from abroad, advising you that you now are outside of the walls of the department and you're going to be pursuing your professional careers, but you have to strive for more than just to be always students or just to always ask questions. You also have to strive to lead, because those things will, if you ask the questions and if you continue to be a student, it will make you not only a better person, also, or a better orthodontist, it'll make you somebody more special in your community. And I spoke to some of the alumni who came back, and you can see from the examples that they set themselves, the PGs that came before you. You know, with Tzachi in Holland, with Stefan, they were telling me what's going on there, and Statis, who's doing things in the society, and Imad, who's the chairman now, and professor in the orthodontic department in the Palestinian Authority, and Evie, who's working hard in her society in Athens. Everyone, one by one, you can go by and see. And we're proud of you, and we're equally proud of them, and we expect big things from you, all of you. And speaking of big things we expect, Rana, now it's you.
Good afternoon. I'm Rana Kadry. I'm from Tira, from Israel. And after you saw the movie that Imbar showed, now I show you a small Arab town in Israel called Tira. Tira is a small town in the Sharon area in the center of Israel. The population is around 24,000 people. 99% of them are Muslims. Visitors like to come to Tira to do their shoppings and to go to the Saturday market, and mostly they would like to enjoy a good meal and fine Arab cuisine. And now my case. Okay, my case is a female that she's 20 years old. She's generally healthy. She have a thumb sucking till the age of 12. She still have a tongue thrust. She have speech problems. She's lisping. And the oral hygiene is fair. If we look in her mouth, we see that she have a lot of malalignment. She have severe crowding. She can't close her teeth. The only contact that she have is on the posterior teeth. The open bite is around between 4 and 7 millimeters. A lot of teeth are blocked out of the arch. She have perio problems. She have recessions, which means that gingival tissue is moved down away from the crown of the teeth. She also have a posterior cross bite, which means that the upper teeth are sitting in behind the lower teeth, which is the opposite from the normal situation. And we see here some problem that at that stage we didn't know what was it. We continue and look at her extraoral pictures. We see that she's making effort to close her lips. We see that she have a mentalis strain. And if we look at this picture, we see that she have an unpleasing smile, an asymmetric smile. The profile is retruded, which means that the lower jaw is behind the upper, and she have a long face, though the profile looks nice. If we look at her smile, we can tell that the smile is asymmetric. And the midlines, we have a shift of around 3.5 millimeters to the left. And if we look carefully, we see that there is a tilt to the left side of the midline of the teeth, the dental midline, but the face is still symmetric. And the lateral pictures, she's in class 1 molar and canine both sides. We see that the tongue is thrusting between the teeth. We see the malalignment, the severe crowding. We see the severe tipping to the mesial of the tooth 26, the increased overjet, the open bite. On the occlusal view, we can see the asymmetric arch form, ovoid arch, and it is constricted and narrow. We see the crowding, tooth 25, that was supposed to erupt between 24 and 26, is missing from in the mouth. We cannot see it, and we see that we lack of space of around 15 millimeters. We can notice also the shifting of the midline here. And on the occlusal view of the lower arch, the arch form is round. There is the severe crowding. Teeth 34, 35 are blocking out of the arch in like a papillon shape. Tooth 36 is an over-eruption. We have malalignments, and we have the calculus accumulation. In the panoramic X-ray, we notice that the wisdom teeth are partially impacted. We have a lot of malalignments, and we can see the impacted tooth 25 that we couldn't see in the picture before in the mouth, and we see some obstacle in its way. On the panoramic, we can evaluate the soft tissue profile, and we see that we can see that the profile is retruded, and she has a long face. It's okay. I don't know. Thank you. So by now, the case highlights. She's class 2 dental malocclusion and skeletal pattern. She have a midline asymmetry. She have lateral and anterior open bite and lateral cross bites both sides. She have a severe crowding, both arches. We have the impacted tooth 25 and the obstacle in the way. We have tongue and speech problems, and she is a long face with retruded profile. Our treatment plan, we decided to treat the case for extractions, which means that we will take out one tooth in each quadrant of the face in order to create space and relieve crowding. And the teeth that we choose, 14, 26, 36, and 45. And for sure, we have to remove the obstacle from the way. Now here we started the treatment after she have extracted the teeth, and we bonded the attachment on the impacted tooth, and we started to pulling the tooth against an appliance that we made in the upper arch, which calls TPA. We're starting to pulling the tooth toward the TPA, and meanwhile we are leveling the lower arch and derotating the teeth and moving them back to create space. Three months later, we can see that the tooth 25 is already in mouth. We continue pulling it, and we're using class 3 elastics to help us. And the lower arch, we continue to derotate and align the teeth. 6 months later, we see that the tooth is more in the mouth. And we also using in the lower arch some lingual bottoms to help derotate teeth and push them toward the arch. 10 months later, we are using a sectional wire here to help uprighting the tooth and continue to close the space in the lower arch. 18 months later, we see that the improvement in her smile, and she looks happier. 24 months in treatment, and we see that the arches are nicely aligned by now. We continue closing spaces. We're using a special closing loop here to help closing the space in the upper arch. And we go on. At this stage, 30 months in treatment, We are at the finishing stage. We're doing finishing bands. We're doing, she continued to wear her elastics to finish the case. And we finished the case nicely. The teeth are aligned. We closed the bite. We fixed the overjet, the cross bite, oral problems, upper and lower. She got fixed retainers in the upper and in the lower arch in order to prevent future relapse. On the lateral views, we see that she's now in class 1 molars and canine relationship. The overjet and the bite are also in good relationship. The before and after, the smile and intraoral. The lateral view before and after. The extraoral pictures before and after. Nice face, nice smile. She's happy and the profile looks even better. And if we look at the SIFs, we see that we improved her soft tissue profile without harming her vertical dimension. Okay, now I want to take the opportunity to thank my teachers. I want to thank my teachers and instructors for their outstanding knowledge and experience sharing us. I was privileged to be your student and to be part of this excellent program. I want to thank my dear husband, Ashraf, for his endless support and love. For without him, I couldn't make it today. I want to thank my dear sons, Habed and Rabia, that they are standing here, sitting, for all the times that I was supposed to be with you and just make all the effort to make it easy for me. So thank you very much. I love you so much. And my parents that couldn't make it to be with me here today because of their medical condition, I want to wish them strength and health for the days to come and thank them for everything they did for me. Finally, my colleagues, it was a great opportunity to meet you in this program. I think it's a unique friendship that will last for a long, long time. And I want to quote Confucius saying, choose a job that you love and you'll never have to work a day in your life. And we did it and we love it and we have to enjoy life. Congratulations.